Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello everyone and welcome to Sensei Podcast. It is my great pleasure to introduce our guest today, Dr. Jacopo Oreglia from Niguarda Hospital in Italy. Jacopo is a great friend, a great CTO and complex operator. He has run a lot of education as well with CTO Live Aid and a lot of meetings in Milan and other parts around the world. So Jacopo, thank you so much. It's a pleasure to talk to you today.
Thank you, Manus. The pleasure is mine. Really, I'm honored to be part of the Sensei podcast and I appreciate your invitation. Thanks.
So, Jacopo, I think you started around 2010, if I remember correctly, your course. And my understanding is that it was a difficult time because there were not many options for many patients. But how did this happen for you? How did you decide to get better and learn and become an expert in CTO and complex PCI?
Yeah, exactly for that reason. I mean, there were a lot of patients that actually were deemed as non-treatable with any kind of revascularization, both surgical and percutaneous, because of the complex anatomy. And what made me really crazy was that some of these patients had a sentence written at the end of their letters or their clinical dossier that was saying this patient cannot be revascularized because of the complex anatomy. And these patients came and came again in the emergency room and the outpatient clinic with the symptoms. And in the same time, we were seeing some of our colleagues, especially the Japanese ones, that were doing something that I really believed it was not possible to do, like to be a space invader or something like that. And so I said, but there will be an option for these patients, and there should be an option for us as physicians to learn new techniques and new options to treat these patients. So that was the curiosity that made me think about doing something different besides the routine cases and start to move towards more complex cases. Then I had the chance to be in a big public hospital where we had a lot of patients with these characteristics. So there was a clinical need to help them. And I also had the chance to work with a young interventional cardiologist, young because he had my same age. We had more or less the same training outside Italy because we both had been in France. And so we started to get together doing these complex procedures, looking at what we could learn from the live cases in congresses and reading, and so starting doing these procedures, starting from the most easy ones, and then going up to more complex ones.
And then how did you learn? Did you actually have people come and proctor you? Did you learn by yourselves? How did you actually learn this?
Well, actually, we had the chance to host Professor Masahiko Ochiai 3 or 4 times in that period. That was really great because we could see one of the top players in the world performing very complex cases. And of course, we had to try to get out everything we could from his presence in the cath lab. Sometimes he was speechless, so we just had to try to understand what he was doing. And what I also saw that he did different things from the first time he came to the second one. So also the techniques in his hands were changing, the use of different materials. But actually we had the chance of having OCI for 3 or 4 times, but then I didn't have a real proctor. So he probably was, let's say, an example. But then we had to learn by looking at other people working during congresses. And I also had a big chance that was the one that of course in Milan, where I'm working, Antonio Colombo was already working for a long time, even if in different hospitals, and it has always been a sort of light to follow. And so this was something that could really help in trying to do new things. But then, most importantly, the young CTO community in Italy was composed by Roberto Garbo, Andrea Gagnor, who are great friends, and Gabriele Gasparini, of course, who is a great friend of mine, still in the high schools. And so we went on doing things together and learning one from the others by sharing experiences, cases, successes, failures, complications.
And then how did you incorporate these techniques? Did you just look at them once and you do them? Did you try to create your own versions? How did you become very good at dealing with these techniques and materials?
Well, I actually think that in this kind of job you need your experience, for example, just to understand how to handle a guide wire instead of another one, and so you need to have your experience. This makes your job more successful with time, of course, as we know. And of course we had also to accept a higher rate of failures at the beginning, but of course I had to do it by myself, and this is what I did. I just tried to understand how to perform the techniques, not to invent any particular technique. And I mean, during time, and you are a master of this, there have been algorithms growing up, and so this made things much easier. At the very beginning, we didn't have really a path to follow, and so it was a little bit more imagination and skills.
And what was the hardest thing to learn? From all the techniques you've done, which was the hardest one to use? The wires, the re-entry, the retrograde?
Let's say that probably the hardest has been the re-entry, I have to say, because in our mind, antegrade dissection and re-entry was not the first choice, and so we started, let's say, first with easy or not very complex retrograde cases. And at the end of the day, I found always myself in doing very complex antegrade dissection and re-entry because I had already failed all the other techniques. So probably this was a bias. Nowadays, by using devices and new guide wires like the MG, re-entry is much easier, and so this is not actually an issue. But at the very beginning, I think that what I found most difficult was the techniques to re-enter from the subintimal space.
And then, how did you deal with the complications and the failures? Were they disappointing you? You were able to get through those? How was your approach to those events?
Of course, this is something that you wrote in a paper, I remember, the 10 reasons why doing CTO makes you a better interventional cardiologist. And one of these was humility. Of course, you have to accept a higher tax of failure. And so you have to accept to be in a bad mood because, of course, when you have a failure, this leads to bad mood. And but this is because we try to do the best for our patients. And so, of course, this was very unsatisfactory for the operator, but most importantly for the patient. The other issue, so failure is an issue. If you have a failure, I learned to be humble enough to send the patient to somebody else, or to call somebody else to help me, or to share the images with somebody else in order to find different techniques and different things to do. And also to talk with the surgeon in some cases when surgery was not considered at a very high risk or useless. So this taught me a lot of things, how to face with failures, thinking at the patient. The other issue is complications. Of course, complications are something that nobody wants, but at the end of the day, everybody has complications. And so by doing a complex interventions, you become much more familiar with dealing with complications. So at the very beginning, you had the shivering hands and the heartbeat rising very high. I was afraid of having complications during these complex interventions. Nowadays, I probably can anticipate those complications, and even if I cannot really avoid the complication, I have more tools to manage these complications, and this makes me much more comfortable with my job, not only in CTO PCI but in everyday procedures.
And then, do you get nervous these days when you do these procedures, or not? You are now so comfortable that you don't really get stressed out about them?
Well, I don't think I'm nervous. I think I am excited, because sometimes you have to deal with such complex cases that this, makes, or it's a sort of something that helps you to stay alive, to do things that are more challenging, and try to think about the case the days before, the hours before, try to plan the case. And so this makes me excited more than nervous, and so that's my feeling.
And are there any cases that stand in your memory that are very vivid for you, that helped you learn and get better?
Yes, I have few cases that I will remember for the rest of my life. Some that went wrong, and some that went well. And yes, for example, I remember, if I can tell you two cases, a very bad one at the very beginning, because she was a young lady with low ejection fraction that was evaluated for heart transplantation, and she had already had bypass grafts, and she had an occlusion of the LAD, and the lima was occluded, and she was done with the impella, and she had a perforation. Of course, post-CABG perforation led to a dry tamponade. It was not possible to make any pericardial drainage, so she went to the operator room, and she had a very long and complex clinical outcome. And so this taught me a lot of things about how to avoid the perforations, and especially how to be very careful in post-CABG patient, especially when you have the support of the impella that sometimes can mask blood pressure drop, and you may realize the complication too late. And another case was not actually a technical, it was a complex technical case that I failed twice after another colleague failed once. And the patient had really refractory angina, and so I proposed to him to do the fourth attempt, and that was successful. And he always sent me text messages to thank me, because now he can work and he can do his life. So these are some of the anecdotal cases that I can remember.
So clearly, some of those people get really affected by what you do and what we do. Are there some things that concern you, for example, radiation and the long cases? Are those bothersome to you? You do special things for radiation?
Well, yes, radiation is something that we are paying attention to in the last years, even if I have to say that when I started my job, nobody told me that we were working with X-rays, and so we learned how to deal with radiation during time. And I think that the CTO community is one of the most careful about radiation in the field of interventional procedures. So what I do, usually I set up my machine at a very low frame rate and low dose. And also when I go proctoring in other centers, what I usually find are machines that are not correctly setted. And so I try to spend the first minutes of the day speaking to the people, to the technicians, and try to tell them how important it is to reduce radiation both for the patient and for ourselves. And more lately, I had the chance to try the Rampart system, which I don't have actually in my hospital, but I had a chance to try it. And so there are new tools and that really may help ourselves to get a lower dose of radiation. And this is, to me, very important.
Wonderful. So, Jacopo, you've been obviously a great operator, but you've also taught many people, both in terms of proctoring, organizing meetings. So how did that come along? How did you decide to get involved in meetings and proctoring and doing all this education?
Yeah, that was really fun because I was in a at a course on the stingray in where was it, in England, actually, together with Gabriele Gasparini. And in that period, we were growing on CTO interventions, and we realized that there was a very good landscape of complex cases during complexes, but there was a sort of lack of education in easier CTOs and in the basics of CTOs. So we decided together to do a course that we called AB CTO, so the ABC of CTOs, that was done on a national basis, and today we are at the 11th or 12th edition, based on how to approach to CTO intervention, starting from, of course, the rationale, but the coronary angiogram quality and going through all the techniques. And that was really nice because I learned a lot of things by doing that. We wrote a book together with Gabriele. Me and Gabriele were very good friends, so it was also great fun in that period. Less fun for our families because it took a lot of time, of free time, and so we started like that. And then the TOBI came, so the TOBI Congress, where me and Gabriele and Bernard and Damiano from this year are involved. And of course the Live Aid, there was an idea that came out during the COVID pandemics. But I think that teaching is something which, I mean, I love teaching, and I learned a lot of things by teaching, because you have to explain what you are doing, or to tell people how to do these things and why they do this, they have to do this and not that. And so this is a good way to go on learning.
Wonderful. And then when you see someone, so your fellows or the people you proctor, can you tell if they're going to be good operators, or it takes you a while to figure that one out?
Well, this is a good question. I think that, I can tell this from the mindset of the people, not from their hands. I believe that our job is 90% in our head and 10% in our hands. Everybody can learn how to move a wire, to handle a tool, but it is much more difficult to learn a mindset and to have an attitude to very long and complex procedure, and to have already in your mind the steps, the plane B, C, D, and E. So sometimes for me it is a challenge when I see a fellow who doesn't look very good at performing CTOs, at performing coronary angiograms, for example. And to me it is a challenge, and I put all my efforts to help him to become better, while sometimes I leave the better ones a little bit apart.
And then what do you think, how long does it take to get good at doing complex PCI and CTOs? Is it a year, 2 years? Is there a time, or is it very variable?
I think it depends on the volume load. Of course, it depends on how many procedures you can do, if you are, and in which center you are working, because it's not a one-man job. I mean, you have to build your team, and also the people who are besides you are very important. To me, it is very important to have an expert operator when you start, and so to have the first operator learning how to perform CTOs, but always having a second operator that follows the CTO program in order to get trained, and sometimes he can be very useful to you during long procedures. So I cannot say how long. I probably think that a good case volume is the best way to learn. And of course you have to do these cases in a row. You cannot do 2 cases in 1 month and then other 3 cases after 3 months. It must be a regular basis, so about 50 cases per year could be a good volume load to start and to learn.
And Jacopo, you've done many excellent live cases. How useful do you find the live cases for people to learn and get better in CTO, PCI?
I think that live cases are very educational, because people from the other side of the screen can see the whole case, and the operators usually choose teaching points during live cases. So the selection of live cases is very important in order to give to the audience good tips, tricks, techniques. And sometimes I was asking to myself, for example, if live in the box could be better than a live case, because you could really focus on some techniques. But at the end of the day, all my experience during congresses told me that live cases were better than live in the box, probably because people are more involved, and I don't know, but I think that is really a nice tool to learn to teach to people.
Perfect. And then when you have the new fellows or the people you proctor, how do you advise them to? How aggressive do you advise them to be? Do you try to push them to get a little more aggressive, less aggressive, or is there no general rule for that?
I think in this case you have to know who you are proctoring, the center and the people. And this is not always the case, because sometimes you go to places where it's the first time they do this kind of procedures. So first of all, you have to know the people you are working with, and also the facilities of the hospital you are working in. Then we start usually with very simple things, but sometimes the case they have selected are very complex ones. So in Italy, we can work on patients even if we are proctors. So sometimes I just do some, let's say, more complex part of the procedures, try to explain. I don't really push them to be aggressive, because I don't think that aggressivity is a good quality in the cath lab. But I just try to show them that sometimes you have to push, and sometimes you have not to fear the subintimal space, or things that we all know. But for people approaching this new, for them techniques is sometimes more complex.
Wonderful. And then how do you keep yourself in good shape to be able to do all this? Do you do exercise? What do you do to keep, first of all, physically fit, but also your mental, being able to be optimistic and committed to these complex cases?
Well, I do much less than I would like to do, because I actually love sports, especially in the outdoors. So sometimes it's difficult. I used to go biking, so I go with the bike on roads and mountain bike, and I like this, especially during the weekends. I do long rides on the mountains. I have the chance that Milan is a city which is well placed in Italy. We have the lakes not so far, the mountains, the Alps about 2 hours far from here, and so I can go there. I love hiking, trekking, and fishing. So this is something I cannot do on a regular basis, because I can do this on the weekends or during holidays, and but I try to get myself fit by doing some bicycle when I can.
And then do you have any favorite books or any favorite movies?
Definitely, yes. Besides your books, of course, which are among my favorites, my favorite book is 100 Years of Solitude by Gabriel Garcia Marquez, which I read 3 or 4 times, and I always find it very nice, like a dream, and it's great. And movies, there are a lot of great movies. I am a fan of Indiana Jones, so probably Riders of the Lost Ark is the best one.
So you like adventure, and you're okay if it takes 100 years to get good at something. You're okay at going on that.
Hope so.
And then, what excites you the most right now, both in the clinical and personally? Are there some things that you're super excited and passionate about?
Well, in the professional field, I think that teaching is something I love, and so I would like to try to move a little bit from being the one who performs procedures in the cath lab to be the one, and I hope so, who can build a sort of school in his cath lab. So trying to have more time in order to teach and to make training and education to the people we are working with every day, who are the most important for me and also for all the other people. So teaching is something that excites me, and I am also excited, but I really don't know how to manage it, by artificial intelligence in medicine and in the cath lab. So it's something that I'm just wondering how could take place in our job. Sometimes, from the one hand, it's a sort of fear for myself and for our job, and on the other hand, it's something that really I'm curious about. And well, on the personal field, I think that now I would like to have much more time for my family, for myself also, and for doing what I love, my hobbies, and that's it.
Perfect. And what are the things that you are most proud of, both professionally and personally?
Well, professionally, I'm very proud of my team. I have to say that I have been lucky because I met a lot of great people on my way, and some of them are working with me, and I am really very proud of them. I go to the hospital, to the cath lab. We do a very complex job every day, not only in CTOs, of course, but everyday life in the cath lab and in the hospital is tough, and having good people as doctors and also as friends is a privilege. And so I'm very lucky for this, and I am very proud of it, because actually I am the head of the team, but I didn't really build all the team. So it was a mixture of luck and willingness. And of course, I'm proud of my family. I have two beautiful kids, a great wife. So I think that they are very important in not only, of course, in my life, but also for my success. Let's say in the professional field, having a good family that supports you is very important, and so I'm really proud of that.
Yeah, congratulations. And obviously it's hard to balance all the ways, the professional obligations and the family part. Do you ever show them angiograms, bring them pictures from home to see what you're doing at work?
Yeah, yes. So sometimes, especially my kids, they look at me when I watch the screen with some spiders moving, and when they were small, they ask me, what is this? And so I try to explain. This is but one of the first words they knew was on call. So on call, they already understood what I was talking about.
Well, clearly it's a lot of responsibility, but you've done a phenomenal work. So, Jacopo, in terms of the people that are starting or early their career, whether in Italy or other parts of the world, if you have to give them some final thoughts and tips and trips, what should they focus on? How can they make it successful for them and for their patients?
Well, I think that having a good training is mandatory, is essential. I always say to the younger people who work with me that what they know, they are what they know, what they can do. And so also to find a good job, it is important to have good qualities, but also to have worked hard in order to understand how to do the job. So education first, hard work. You need also to be sometimes lucky to find yourself at the right moment in the right place, but this is probably 1% of the entire system. So probably you have to be really very focused on that. And last but not least, I think that passion is key, because Of course, this is like many other jobs. It is a hard one. It takes you a lot of time, a lot of efforts. And if you are passionate about your job, this will be much easier. And so I think that it's very important to transmit also passion to the younger, because they need this to go on. I think that we are very, very lucky, because we are doing to me, the most wonderful job in the world. So this is really a privilege, but we have to keep on thinking this, and so to, grow our passion for it.
And Jacopo, I think you make great points, but there's sometimes the question, okay, is the passion coming first, or you get more passionate after you're doing it and getting better at it? How does that work for this particular area?
I think it is a sort of trade-off, because sometimes you do something for passion, and then when you are doing this, you understand that this is not exactly what you were thinking of, and then you start doing something else, and you find something that makes you passionate of during something that you didn't really plan. For example, in the field of interventional cardiology, there are a lot of new interventions like structural heart interventions. Many people are passionate for them. Then when they start doing that, and they understand that it's a great job, but then they come to my place and I tell them, okay, this is beautiful to do mitral valve repair, TAVR, but try to do a CTO. Stay with me, get passionate about CTO. They really get passionate about that. So it's in the middle.
Wonderful. Well, Jacopo, once again, thank you so much. Again, wonderful talking to you. Congratulations on all the great things, both the clinical and the teaching and the meetings that you've been doing. And we're super excited to keep on working with you down the line.
Thank you, Manos. Thank you always for what you do for the interventional cardiology field, and it's great. Thanks.
Thank you for listening to the Sensei podcast.